Hello, in today's video, we're going to talk about the worst 5 food for prostate health, and then we'll give you the best information on what you can do to shrink your enlarged prostate. Then we'll discuss some of the best foods and tips to address the problem of prostate enlargement. An enlarged prostate, otherwise known as BPH, is a common problem in men, especially those over 50. This condition can make it hard for men to urinate, cause them to have to go to the bathroom more often, and hurt their pelvis, stomach, and the area between their scrotum and anus.
So what's really happening here? From this picture, you can see that the prostate is a small gland that sits right below the bladder, which is the organ that holds your urine. The urethra is the tube that your urine goes through. When the prostate starts to get bigger, swell up, or grow, it puts pressure on the small tube, the urethra, that connects your bladder to your body. This is where the problems start, because the swelling makes it hard for your urine to pass through the tube properly. The urine starts to back up and get stuck in your bladder. This can make it hard to hold your bladder in, especially at night when you are trying to sleep. You may have an urgent need to pee, sometimes with only a small amount of urine coming out. You might have a weaker stream of urine, which could stop and start as you urinate. Or you may have to strain or push to get the urine to start coming out.
Studies show that hormonal imbalances like a buildup of anabolic hormones like estrogen, insulin, or DHT cause the prostate to get bigger. Unfortunately, some foods have been shown to make these hormones work harder, which makes the prostate swell up and get bigger, increasing the chances of getting prostatitis, infections, and prostate cancer.
In today's video, we're going to share with you the top 5 foods to avoid if you have prostate enlargement. You'll also learn about some simple lifestyle changes and remedies that you can use to help shrink your prostate and improve your urinary flow.
Just a quick reminder that this video is only meant to teach, so if you are worried about your health, talk to your doctor.
The first food to avoid is dairy. If you have an enlarged prostate that is making it hard for you to urinate, you should stop eating dairy products like butter, cheese, milk, yogurt, and cream. Dairy foods are made from cow or goat milk, and they contain prolactin and IGF-1, which are natural growth hormones that help young animals grow. These can irritate a prostate that is already large, causing the gland to swell and put pressure on your urethra and bladder. If you don't have prostate problems, dairy foods are very nutritious and healthy. But if you do have an enlarged prostate, try going without dairy for a week or 2 and see if your symptoms get better.
The second food to avoid is vegetable oil. Most cooking oils, like soy, corn, cottonseed, canola, grapeseed, and rice bran, are made from highly processed and genetically modified grains. Despite what their names might suggest, these oils are not made from vegetables. Fast food, ready-to-eat meals, deep-fried meats, store-bought salad dressings, margarine, and coffee creamers all use vegetable oils. Omega-6 fatty acids cause inflammation, and these oils are full of them. This can cause a lot of inflammation in your prostate gland and especially in your liver. Your liver is very important because it helps keep your hormones in balance and gets rid of the ones you don't need. But when you eat these refined oils, you weaken your liver. When this happens, hormones like estrogen and insulin build up in the body, which makes the prostate grow. The walls of your bladder also lose tone and become weaker.
So stop eating these things and cook your own healthy meals at home with extra virgin olive oil, cold-pressed avocado oil, and organic raw coconut oil. We also think you should eat more oily fish like salmon, sardines, and eggs raised on pasture. These are anti-inflammatory and will fix any damage caused by eating too many vegetable oils. If this information has helped you in any way, please click like, subscribe, and allow notifications to stay up to date on our latest health and nutrition tips.
Okay, let's go to the third food to avoid, which is sugar. When you eat refined sugar, flour, grains, or starch, your body quickly turns them into blood sugar. This can quickly hurt your cells, especially if you eat a lot of sugar at once. Your body makes insulin, a hormone that pulls sugar out of your blood and puts it into your cells to make fuel and energy. This keeps you from dying. The problem is that your pancreas makes more and more insulin as you keep eating refined sugar and foods that turn into sugar. Insulin is a growth hormone, so when there is too much of it, the prostate grows quickly. Because your kidneys are getting a lot of sugar, you have to go to the bathroom more often, especially at night when you are trying to sleep. Start cutting back on fruit juices, sweets, biscuits, pastries, breads, sodas, cereals, and other flour-based foods that are high in sugar and carbs. Don't eat after 7 p.m. and let your blood sugar level out. You'll soon notice that you have to go to the bathroom less and that you sleep much better.
The fourth food to avoid is soy. Soy that hasn't been fermented. We've already said that soy oil is very inflammatory and can cause the prostate to get bigger and the liver to get sick. But it's also important to know about the cheap soy proteins that are being put in your food. Soy protein isolates are often added to diet shakes, ready-to-eat meals, vegan meat patties, protein bars, baby formulas, and processed meats. Soy protein isolates cause a massive increase in insulin in the body, an anabolic hormone that can make BPH and LUTs worse. Soy powder also makes more estrogen, which is another hormone that, in high amounts, can cause the prostate to get bigger. Soy is also genetically modified, and it is grown with pesticides, herbicides, and insecticides, which can mess with hormones. Lastly, soy has a lot of phytic acid, a chemical that can stop your body from absorbing minerals like zinc, which are needed for the prostate to work well.
So if you have any prostate issues at all, cut out 100% of all unfermented soy products. Organically fermented soy foods like miso, soy sauce, tempeh, tofu, and natto are fine. However, when soy is fermented, the harmful effects are taken away by the microbes. This makes soy much better for your body.
The fifth thing you should avoid is alcohol. Alcohol is a solvent that harms the liver cells and alters hormone levels in the body, such as increasing estrogen and insulin levels. When you have too much of these anabolic hormones, your prostate grows and your blood pressure goes up, which makes your arteries and blood vessels weaker. Reduce your drinking, especially beer, which is very estrogenic. Instead of drinking too much alcohol in the early evening, try drinking 1-2 cups of kombucha tea to help calm your body and nervous system without drinking too much alcohol. This fermented drink helps the good bacteria in your gut get rid of toxins and make more bile, which cleans your liver and keeps your hormones in check.
Later in the video, we're going to share with you 5 lifestyle changes and remedies that you can use to help shrink your prostate back down to its normal size. But first, let's look a little deeper at a few of the most common causes of prostate enlargement so that you can really understand what's happening.
The first and most common cause of an enlarged prostate is eating too many refined foods like sugar, processed grains, and flour, which deplete your zinc stores and raise your levels of DHT, insulin, or estrogen. By chance, being overweight can also cause the prostate to get bigger. This is because the more fat you have, the higher your levels of estrogen and insulin, which could be making the gland grow.
Another issue is that as we grow older, our stomach acids get weaker, which makes it harder for us to absorb zinc and other nutrients that are important for a healthy prostate. If you have liver damage, you are also more likely to have hormonal imbalances because your liver helps filter out excess hormones. Non-organic foods that we have talked about in this video contain trace amounts of pesticides and chemicals, which all damage your liver, resulting in hormonal imbalance and potential prostate enlargement.
Finally, if you already have prostate enlargement, dairy foods and processed meats may be making it worse because they contain growth hormones and hormone disruptors. Now let's find out what lifestyle things we can do to help shrink our prostate and keep it down.
1. Start eating a small handful of pumpkin seeds on a daily basis, as these are some of the most potent BPH-fighting foods that you can eat. These contain zinc, phytosterols, and vitamin E, which work together to balance your hormones and shrink your prostate. If you have urination issues, consider taking 120 milligrams of stinging nettle root 3 times per day. This natural herb helps to reduce inflammation in the prostate so that you can empty your bladder normally. It works by preventing a buildup of DHT and estrogen. Cut back on the foods listed in this video, especially dairy, sugar, vegetable oils, and overprocessed meats, which are causing hormonal changes and inflammation in the prostate.
Also, if you smoke, cut down on how much you do it and quit. When you smoke, you hurt your blood vessels and make your prostate grow. Eat a salad with organic cruciferous vegetables like radish, broccoli, arugula, kale, collard greens, or cabbage every day to get these hormones back in balance. The sulforaphane and diindolylmethane in these vegetables help your liver get rid of the extra hormones that are making your prostate grow. Eat whole foods like tomatoes, wild salmon, shellfish, organic grass-fed beef, avocados, and green tea. All of these foods have things in them that help keep the prostate and seminal fluid healthy.
Finally, start doing interval training with a high level of intensity. Just 10 minutes of HIIT twice a week can make a big difference in a man's testosterone levels and help lower other hormones that build muscle, like DHT, estrogen, and insulin. Exercise also helps get rid of extra sugar in the blood, which could be making the prostate swell.
That's all for now. Subscribe to our channel to get more natural healthcare tips.